Good morning, everyone. My name is Andy Tai, and I'm a PhD candidate at the University of British Columbia. My supervisor is Dr. Michael Kraus, the individual that had introduced and is the lead in running this Let's Talk Overdose crisis. And today we'll be discussing a very important topic in the field of mental health. We will be discussing why engagement and adherence are important metrics in online mental health interventions and some strategies to increase engagement and accessibility with the use of artificial intelligence, machine learning, and natural language processing. In terms of my thesis, I am doing research with a focus on utilizing machine learning and AI to predict the risk of fatal overdose, which has a lot of overlaps in terms of applying these machine learning techniques with novel online e-health platforms. I will also present some studies that have highlighted the importance of how to deliver interventions and allow users to engage with online solutions. Lastly, as I said previously, as I was introducing myself or asking people to introduce themselves in chat, we'll split into some breakout rooms in which I'll assign some questions to each group related to the use of chatbots in the settings of e-mental health. And there we can openly discuss any questions that may arise throughout this presentation. So some of the key topics that I'll be addressing today include examples of some online interventions, defining what engagement and adherence are and why this is important metrics, and what are chatbots, virtual chatbots, and how can they be useful in an e-health setting. So what are some key terms that we should define? So first off, we should define things like online interventions, engagement, adherence, which are key terms with basically metrics for measuring online interventions. Artificial intelligence, what is that? What is natural language processing? And lastly, how is this applied to things like virtual chatbots? Maybe give some examples so everyone in the audience can see. So first off, I'll define internet interventions. So of course, we know things that are applied in day-to-day life in terms of mental health interventions, things like cognitive behavioral therapy. So internet-based mental health interventions are not meant exclusively as a replacement to face-to-face interventions. They can act both as a gateway to a person's receiving in-person help and to supplement such help. And we'll later discuss a little bit more about this in forms such as things called blended treatment. So some pros in terms of online interventions include things like online interventions can be accessed from anywhere, anytime, making it easier for individuals to access mental health support, especially for those living in rural or remote areas. Online interventions can be completed at the user's convenience, of course, without the need to schedule appointments or travel to a therapist's office. And this can make it easier for individuals to fit mental health support into their busy schedules. Some individuals may also be comfortable seeking mental health support online as it provides a sense of anonymity and reduces social pressure. Online interventions can also allow for can be tailored to the individual's needs and preferences with personalized messaging and content, and this can help to increase engagement and motivation. So some recent studies show that internet-based psychoeducation and cognitive behavioral therapy are effective in increasing depression literacy, reducing dysfunctional thinking and depressive symptoms, and also decreasing stigma. Also, a recent meta-analysis suggests that the effectiveness of online programs is comparable to traditional face-to-face treatment delivery with all the benefits that I basically just listed. So what is online engagement in all of this? This is basically one of the key topics that we want to discuss right now. We've talked a little bit about online interventions. So online engagement refers to the level of involvement, interaction, and connection between individuals in online interventions for mental health. Engagement can be referred to a range of different behaviors, such as active participation in online sessions or activities, asking questions, providing feedback, and utilizing self-help resources. And as many of you may know, engagement is one of the key metrics to basically gauge whether or not patients are getting better or not. So in 2015, Camille et al. Proposed a model for designing effective online behavior change interventions that engage users and promote sustained behavioral change. So some things that are proposed within this model are things like using persuasive technology that allows users to basically engage in desired behaviors or actions. User engagement, which is, again, one of the things that we're talking about in this presentation. The level of user involvement, interaction with the intervention can be increased through personalization, interactivity. So things, for example, chatbots, which is a foresight for what we're going to be talking about later on, social support, and behavioral change techniques, specific techniques used to promote behavioral change, such as goal setting, feedback, and rewards. Content that's personalized to the user, individual's characteristics, needs, and preferences. And of course, this can be utilized, this personalized content can be done through machine learning. And then the paper also discussed the importance of considering factors such as user motivation, behavioral context, and potential barriers to behavioral change when designing online interventions. So what is online adherence? So it's very much related to engagement, but online adherence refers to the extent to which individuals engage with and adhere to online interventions for mental health. So this metric is basically measuring how much of that population in treatment are staying in treatment. So engagement is sort of the action of engaging with these online treatments, for example, things like CBT online, and adherence is basically the measure that refers to a range of behavior, including attendance, completion, and actively engaging with the content of the intervention. So measuring and promoting adherence, of course, is a key component to the development and implementation of effective online interventions for mental health. And mental health professionals can use various strategies to promote adherence. And today we're going to be talking about how AI and chatbots can help with adherence to online interventions. So what are some adherence measures? So online adherence measures are methods used to assess and monitor. Of course, we have to define this since these are key metrics to how well, for example, someone is performing based off of some sort of novel interventions or novel technologies that we're trying to implement within these interventions. So online interventions, so there are several ways online adherence measures can be used for online interventions. And one example is, for example, session attendance, which involves tracking how many online therapy sessions a patient attends and whether they can complete each session in its entirety. Another example is time spent, which involves measuring how much time a patient is engaged in the online intervention, of course, completion of modules, which is important online adherence measure, and self-reporting is another measure that can be used where patients report on their adherence to the online intervention. Activity logs, which is looking at and tracking monitoring online adherence. And lastly, gamification, which is, of course, it's incorporating game design elements such as reward, point systems, and other incentives that are designed to motivate patients to engage with the intervention and adhere to treatment plans. So what are some ways to improve adherence? So things that we just basically talked about before: personalization, tailoring the intervention to individuals' needs, preferences, and goals can increase their motivation and sense of ownership. Providing regular feedback on progress and reinforcing positive behaviors can help individuals stay on track with interventions. Providing ongoing support, guidance, and encouragement can help individuals overcome barriers, obstacles to engagement and adherence. And e-health components, things like blended treatment, in which e-health components are provided as an adjunct to existing conventional treatment, and education and skill building, which help individuals develop the knowledge and skills that they need to manage their mental health and engage with the intervention. And lastly, encouraging open communication and collaboration between the individual and mental health professional that can help build trust and a sense of partnership. And so in one of the reviews that I was a part of, we looked at two different ways in which adherence can improve two ways to improve adherence in an online setting in a more traditional sense. So two of the things that we looked at was support and guidance and blended treatment. And so in our lab, I was part of a systematic review of literatures published between 2009 and 2022. We looked at some traditional ways to increase adherence, as I previously stated. And the things that we're looking at were, so we did a meta-analysis and meta-regression to analyze the data. And we hypothesized that adherence to online treatment would be positively associated with clinicians guiding the treatment. We also thought of the same correlation, we also thought that the same association would occur between adherence and blended treatment. So this is a table showing the mean adherence from the 24 different studies. And in this scatter plot, the scatter plot shows that there's a positive correlation between guided online treatment and adherence, meaning that treatment that was online in these specific studies, clinicians were guiding this online treatment with patients, and this, of course, resulted in a higher adherence with patients in terms of completing the treatment. So what that means is when clinicians are actually guiding the patient through specific online interventions, they end up staying in that intervention for longer, which is a pretty reasonable result. And for this other result shows, this other scatter plot shows that there was a positive association between blended treatment and adherence. And what this means is that it showed that when you were pairing online interventions with real life interventions, there was also a higher adherence rate, meaning that, again, online interventions shouldn't be solely replacing these in-person or more traditional ways of treating, different mental health disorders or illnesses. So now that we know some traditional ways to increase adherence, how about we dive into some other tools to increase adherence? So things that we might propose or things that we might hypothesize would be interesting would be using things like artificial intelligence. So what is artificial intelligence? It's the development of computer systems that can perform tasks that are typically required human intelligence, such as learning, problem solving, decision making, and language processing. And AI systems are designed to mimic the cognitive abilities of humans using algorithms and statistical models to identify patterns in data, to make predictions or decisions based on that data. So one subset of artificial intelligence is something called natural language processing. Of course, many of you may know ChatGPT, of course, is utilizing both machine learning as well as natural language processing, which we'll dive a little bit deeper afterwards. But natural language processing involves developing algorithms and models that enable computers to understand, interpret, and generate human language. And of course, as you can see with ChatGPT, NLP is used in a wide range of applications, such as chatbots, virtual assistants, language translation, sentimental analysis, and text summarization with things like, for example, Siri on our iPhones. These techniques enable computers to process, understand, and generate human language in a way that's similar to how we do it. And by using NLP, AI systems can interact with humans in a more natural and intuitive way, enabling them to perform tasks such as answering questions, providing recommendations, carrying out conversations. So why is this important? This is important for us because this is an advance in technology in the field that can create chatbots for various functions. So not only increasing adherence with things like delivering treatment, but things like triaging, et cetera, which we'll talk a little bit about later on. So what is supervised learning? So supervised learning is a type of machine learning where the algorithm learns to make predictions based off of labeled data. This is important because ChatGPT and other chat models use a combination of these different techniques. So not only do they use NLP, which was actually one of the previous generations of ChatGPT, which they used, which didn't yield amazing results, but they also incorporated things such as supervised learning to make it more of an active training model, which makes it even more, for example, realistic in terms of imitating human conversation. So the goal of supervised learning is to learn from multiple different input features and output based on labeled examples provided during training. To understand supervised learning, we need to, of course, define some key features. So we have first input features, and these are variables or attributes that the algorithm uses to make predictions. For example, if we were building a model to predict housing prices, the input feature may include things like number of bedrooms, square footage, and neighborhood. So if we're trying to predict things like overdose, maybe we would input features that include things like demographic features like age, drug use, what kind of drugs they're using, and mental illness, neighborhood that they're living in. So the output variable is the variable that we want the algorithm to predict. In this case, for the overdose, we would want the model to predict, for example, how likely is an individual to overdose. So it has to be a labeled data set, so we know, for example, what the input features are. And so the model is basically looking at the correlation between this label data and the specific data or the specific prediction that we're looking for. So in the case of ChatGPT, it's interesting because it uses the supervised learning models, since after, for example, you have a specific output, you're asking it a question, after you actually see the answer, ChatGPT or OpenAI allows you to upvote or downvote. And based off of this upvote or downvote, it then calculates and accumulates all the different responses that other people have. And of course, they have computer scientists in the background looking at if answers are downvoted, why that is, to, for example, adjust that supervised learning, machine learning algorithm. So lastly, we'll talk a little bit more about deep learning. So deep learning is a subset, and again, used by ChatGPT. And this is a little bit more complicated since supervised learning is sort of one layer. Deep learning is more so inspired by the structure and function of the human brain. So in deep learning, the algorithm learns to make predictions by building multiple layers instead of just one layer of non-linear transformations to the input data. So to understand deep learning, we need to find, of course, some key terms. So, of course, again, we have input images, so input layers similar to supervised machine learning, but instead of just one layer, we have multiple different layers that sort of, like a human brain, in terms of neurons, communicate to one another. So this layer is hidden, and it's basically a black box. So these models, it's very hard to understand really what the interaction of the different variables are, but instead we're trying to create a better, more accurate system or machine learning model in this way. And deep learning algorithms learn to make predictions by adjusting the weights of the connections between the neurons. So the neurons are basically layers of variables, and the training involves feeding the algorithm labeled examples again, similar to supervised learning, but sort of the mechanism in terms of how the layers interact is fundamentally different. So now that we know a little bit more about the background of how these chatbots are built, let's talk a little bit more about them. So virtual chatbots are computer programs that use AI, NLP, machine learning technologies to stimulate human conversations and interact with users through text or voice-based interfaces. So chatbots are designed to understand and respond to natural language inputs from users, and using pre-programmed responses or machine learning algorithms to provide relevant information, answer questions, and perform tasks. So virtual chatbots in mental health may be designed to provide information on mental health conditions and treatments, offer support and advice, or facilitate self-management and coping strategies. So some chatbots may also be designed to triage users and connect them with mental health professionals or other support resources, depending on their needs and preferences. So next, I'll be giving some examples of some chatbots that have been created to help engagement and overall adherence in online interventions. So there are some examples that of course exist today, which include things like Wobot, Tess, and Wissa. And ChatGPT, of course, I'm adding that there to talk a little bit about the potential of the use of, this exploding, new tool that everyone seems to be in love with.
Need to get something off your chest? Meet Wobot, the friendly little bot who's ready to listen 24/7. Wobot's been trained in cognitive behavior therapy, an approach to mental health that is all about identifying distortions in your thinking. Wobot doesn't do therapy, but he can be your guide to help you figure out things on your own. Oh, and he's effective. Some nice people at Stanford University demonstrated that chatting to Wobot for 2 weeks led to significant improvement in mood. Every day he asks how your day is going, how you're feeling, and what you're up to. He builds an emotional model of you over time and can help you see patterns in your mood. As he learns about you, he'll teach you things, like useful strategies and practical tools that have been shown to work. You're not troubling him at all. Honestly, he has nothing else to do. So let Wobot annoy his way into your heart and start feeling better today.
So that's one of the examples in terms of already existing chatbot. Let's look at another one called Tess. So built by psychologists, used by more than 19 million people, Tess is a mental health chatbot that coaches people through tough times. Of course, so this is more a similar text-based chatbot in which you can kind of have conversations with it whenever you need. And once you send a text, it sort of asks you things and kind of tries to prod deeper and try to triage users, whether or not it's an emergency or for example, if they need to seek treatment. So this is also a very useful tool. This is another chatbot called Wissa, in which
Stressed out about school? Relationships got you down? Frustrated about the new normal? Meet Wissa, your mental health buddy. Chat with a friendly AI penguin to explore your emotions and disprove your negative thoughts. Don't feel like talking? That's okay. You can use an entire library of mindfulness exercises for anxiety relief, depression support, and stress management. Create your non-judgmental, safe space and keep your mind healthy and happy with Wissa. Download now. Stressed out?
So that's another example. And lastly, let's talk a little bit more about ChatGPT. Of course, another interesting use of NLP and machine learning is ChatGPT, which is a powerful language model that can be used to create chatbots that are specifically designed to improve adherence, that can be used to improve adherence in online interventions. So these chatbots can engage in personalized conversations with patients, provide them with support and encouragement, and help them stay on track with their treatment plan. Overall, I think that chatbot is an exciting tool, of course, with many different applications, from academia to mental health interventions. But by creating personalized chatbots that are designed to increase adherence, we can help more people access the support that they need and improve outcomes for patients with mental health conditions. So a recent study conducted in 2019 investigated the effectiveness of adding a supportive chatbot to a smoking cessation app on user engagement. And the study was conducted as an experiment where participants were randomly assigned to two groups, intervention group and also control group, in which the intervention group received an app with a chatbot, and of course the control did receive an app without. And the study measured user engagement with the app in terms of app usage, completion of smoking tasks, cessation tasks, user rating of the app usability and satisfaction. And the results showed that the addition of supportive chatbots to the smoking cessation app led to increased user engagement, as evidenced by higher app usage, task completion rates in the intervention group compared to the control group. So as you can see here, we can see a much higher login rate, and usage rate compared to the power users in the control. Furthermore, users in the intervention group rated the app as more usable and satisfying than those in the control group. So of course, there are some limitations. We will kind of talk a little about these limitations, and then I'll give an overview of the key topics, and then we will dive into our breakout session. So some limitations of online interventions include the fact that online interventions can lack the human interaction and connectivity that is typically present in face-to-face therapy. This can be particularly challenging for individuals who may be struggling with feelings of isolation or loneliness, but of course we can combat that with things like blended treatment or have guided treatment. Online interventions rely on technology, of course, which can be prone to technical issues such as poor internet connectivity or software malfunctions. And these issues can be frustrating for both the user and the mental health professional. Online interventions may limit non-verbal communication, which can make it more difficult for mental health professionals to pick up on subtle case cues or nuances in the client's behavior or mood. Online interventions may raise privacy concerns, of course, particularly in relations to the storage and handling of sensitive personal information. Online interventions may be suitable for individuals with severe or complex, may not be suitable for individuals with severe or complex mental health conditions, or those who require more intensive or immediate support. And as online interventions are relatively new, there might not be subject to the same regulatory oversight and quality control as traditional face-to-face therapy, which is, of course, the case with all these wellness tools popping up in the App Store. Lastly, engagement with digital interventions is, of course, critical for their effectiveness. However, retaining users' engagement throughout the intervention is always challenging, which is why we're, doing this presentation. So, of course, technology has revolutionized the way we live and work, and it is now transforming the way we approach mental health. So one of the most exciting developments in this area is, as I've talked about, AI, and these are sort of an overview of the topics that we talked about. Of course, virtual chatbots, and all of this sort of thing surrounding it supports these different pillars support this sort of structure to give personalized treatment interventions and continued treatment interventions for mental health patients. And it all kind of serves around and revolves around increasing online engagement, increasing online adherence, and personalized treatment with novel technologies such as machine learning, which can do stuff like risk assessment, which can help cater into specific interventions that can be delivered by virtual chatbots that are ran with NLP.